Welcome back to the Wholesome Pharma channel, brought to you live on the Seavine Natural Health News Network. I'm your host, Linda Forsythe. Were you aware that acupuncture has been widely used directly on the battlefield in the United States military? And it's been done so for the last 10 years? Most people aren't, and we're here to explore how and why it is employed. Acupuncture has a multitude of applications for incredible results, and now we're learning the military is using this technique on our wounded, actually out in the battlefield. For our feature story today, we brought back by popular demand Dr. Erik Koda, who is an MD, and he's a family practice physician. But Dr. Koda also has a unique area of expertise for a medical doctor as he specializes in acupuncture, and he combines integrative medicine in with the traditional. What makes him unusually qualified to speak about today's subject matter is Dr. Koda previously served in the United States Air Force for 25 years, and he retired in 2015 as a colonel. While serving in the military, the good doctor was assigned to the Air Force Acupuncture Center and was also a military family physician and a flight surgeon. The fact that he also supervised his medical team as a colonel out in the battlefield utilizing acupuncture has made him a valuable resource for this fascinating subject. Well, thank you, Dr. Koda, for joining us again today.
Well, it's good to be here again, Linda.
Well, you know, it's interesting. Some people, when they hear that acupuncture is done actually out in the battlefield, you have some raised eyebrows where they picture some of these traditional long acupuncture needles being popped into, some of the soldiers out in the field, and it doesn't seem practical or, even how it could even possibly be beneficial. So why don't you explain to us the functionality of how it works and specifically what it is used for?
Well, it's specifically used for pain relief, and it was the brainchild of Air Force physician acupuncturist named Dr. Richard Nemsau, who did a lot of research to figure out the most ideal points for pain relief that were reproducible, and combined that with these very short needles that were developed, I think, in France, which can actually stay in for anywhere from 3 to 5 days. And they're very short. They don't get in the way of anything. And actually, they're very practical to wear pretty much anywhere, even on the battlefield.
Okay, so you're saying some of these short needles. Now, I've personally seen them, and they are like little tiny micro short tiny needles that do manage to stay in. It seems, at least some of the pictures I've seen, that these needles mostly go into the ear and they just stay there. Is that true?
Yeah, and so these needles are about 1 millimeter long. The outside of the needle, so the hub or the handle, is probably about 1 millimeter long. So it's very tiny. They're much smaller than the smallest earrings you could ever find. So they're very tiny, and it's very practical. They can, if they're worn by people in uniform, even on the battlefield, and they really don't get in the way most of the time. And the nice thing about using them in a combat situation would be that really, as long as a person has an ear or two, you can access it very easily. You don't have to disrobe them. You can get to them, and as long as they have an ear, they're probably still alive. If they don't have an ear, there's probably a good chance they're not alive anymore.
Well, yeah, that makes sense. Let's talk a little bit about the traditional methods in pain relief. Before you guys started utilizing acupuncture, what did you used to do?
So a typical scenario would be that someone was injured, and maybe, it'd be the middle of a battle, and so there'd be a combat medic who would have to get to the person, maybe dodging some fire or some explosions, and put in an IV and give the person some narcotics or morphine or something along those lines. And if you can picture that then takes two people that are potential people that are able to fight back out of the battle at the same time, because even after the person gets their medicine, they're impaired, and then the person who's the combat medic has to monitor them indefinitely until they're back to basically back to a hospital, away from the front lines.
As a former nurse myself, I'm just kind of picturing what it would be like. It's like you have bullets going on around you or explosions, and getting to a wounded soldier and then trying to find a vein or an artery, or not an artery, a vein, to be able to insert the needle and then stabilize the needle and then drop, maybe you don't have to drop the medication, it's already pre-drawn up, I'm assuming, and to give the medication intravenously, which can in and of itself be dangerous if it isn't monitored closely while all this stuff is going on. And hopefully, your soldier is staying still, because sometimes when they're in pain, they're not staying still. I just, oh my goodness, I can see such chaos. So with that being said, now obviously morphine intravenously is going to, work fairly quickly for pain relief. How comparable is the pain relief with this acupuncture when it is applied? Is it a comparable pain relief?
Well, the immediate pain relief has been shown to be pretty consistently close to 80% of people, basically responding with pretty decent pain relief. And, some of the pain relief can be as good or better than that of morphine. I mean, some people can get complete pain relief. And so yeah, case by case. Some people it would be more, some people it would be less, but about 80% of folks would actually respond well.
Okay, and the percentage of pain relief when you're having IV medication, is the percentage comparable to that? I mean, providing it stays in the vein?
It's pretty comparable. I mean, but, some people won't get adequate pain relief from that either. And clearly the majority of the people are pretty significantly impaired, from the injury itself, but also, you have to worry about their breathing and their consciousness with the medicine like, morphine or any other narcotic that they do.
Well, that makes sense. And if it's like tiny little needles that go into the earlobe or, the outer portion of the ear, if they need to be intubated or any other various different things, these things aren't getting in the way from you being able to function in other areas that are necessary, right?
Right. And the genius about this technique in that setting is that now you have, whoever the medical person is for that unit can go out and, as long as the person's not bleeding to death, it's an injury that needs pain relief, they can put the needles in a couple minutes, basically. And the person who is treated is not impaired, and the person who does the treating no longer has to monitor that person. And so there are two people that are still in the fight, essentially, that weren't there before, that would have been completely taken out of the fight. And so it enhances the capability of that unit.
Well, I can certainly see how this would be of huge benefit. Now, you as a physician, as an MD, had gone through medical school, and generally you are taught traditional medicine, which I'm assuming is the case with you, and then you get into the Air Force, and you're in a command position, and you're finding out that they're using acupuncture. Was that really strange for you to hear? And how did you learn the skill set that you learned?
So it's very interesting. So the Air Force just didn't decide to do acupuncture. Basically, the doctor I mentioned earlier, Dr. Namesau, was kind of a rogue cowboy of a doctor back in the day, maybe 15 years ago, maybe 20 years ago. And so people thought, understandably, that there's some crazy guy that carries around these acupuncture needles that wants to, treat people, and they thought that was pretty crazy. So what he did was kind of genius, and so, the basic story is that he went around telling folks that, he'll take anybody who they can't fix, who they've given up, they've tried all the traditional methods, and they can't figure out what to do with a person, and give them to him, and he'll try out acupuncture on them. And so I was one of those people, and I was curious. I thought it was pretty ridiculous, but I was curious, so I gave him a few of my patients that weren't fixable, and and went in when I could to watch him do his acupuncture. And then amazingly enough, some of these patients would get a lot of relief. They'd say things like, "I haven't felt this good in 10 years," or I've forgotten what it was like to not have that pain, or something like along those lines. And after one person, I was going, well, that's interesting. And, as I saw several more people, and I saw that the response rate was pretty decent, I thought to myself, I need to do some of this. And along the way, the military, the leadership of the military got to thinking the same thing. So it just snowballed from there.
Well, that's fascinating because it's interesting that you tell us that you were skeptical at the beginning. In fact, you said you thought at first glance it was rather ridiculous. And so what pretty much convinced you was some actual situations that were pretty amazing that actually worked on patients who had not been helped before by anything else traditional.
Exactly.
You told me a story that you haven't mentioned yet here about one of your patients and what had happened. And I don't know if it was, well, you go ahead and tell the story. I think you know which one I mean. I hope.
Right. So this is one of, I've got stories all day long, but this is just one of them. And so there was a guy that came into my clinic a couple of years back that said, and the first time I met him, he said, well, they, a couple of years ago, they took out my gallbladder after I told him I had this pain up in the area of his abdomen where the gallbladder was. And he said, well, as soon as he got out of surgery, he told the surgeon, well, he didn't get rid of my pain. My pain's still there. And so a couple of years later, he came to me, and, I was just seeing him for the first time, and he told me that story, and I looked at him, and I examined him, and I thought, well, I think I can fix this with acupuncture. So I did an acupuncture treatment on him, and, it helped him that day, and, I saw him at least 6 to 12 months later, just for whatever reason. I might have even just been passing him by in the hallway, and he said, hey, that pain never came back. So that was one of many stories like that. I have got lots of stories like that.
So this guy had been having pain for a long time, and they removed an organ. They removed his gallbladder.
Right.
Excuse me. And it still didn't help. And so he, came to you, and you did one treatment, and 6 months later he was still completely pain-free? Exactly.
And so, yeah, and that's one of many stories like that. And what happens to these patients a lot of times is, it's pretty typical. It's like, well, we know it's not going to kill you, so have a nice day. There's nothing else we can do for you. That's what they get told by the medical system frequently in cases like that. And so they just end up living with the pain, and they just live with it indefinitely.
Well, I know from other interviews that I've conducted with you that acupuncture can be used for a multitude of other things. But let's go ahead and stick with the pain relief here, especially since it was used out on the battlefield. You told me about an article that was written a couple of years ago that was actually published in Forbes magazine. And you were not happy with this article, and from what I understand, apparently nor was a number of the people who were in the military who have seen the huge benefits of acupuncture, working beautifully out on the battlefield, where this doctor was just having a field day, so to speak, in discrediting this being absolute bunk. And so I looked at this article, and I would like to discuss this a little bit with you. And so there can be some sort of rebuttal here because, quite frankly, I looked this guy up. And even though the particular article you are speaking of had been done years ago in Forbes magazine, he's been around for, quite a bit of time. And this one particular guy, he's been like a main naysayer who's been around for years, and in my opinion is one of the darlings of Big Pharma. It is so flippin' obvious. He seems to be everywhere. He's doing all he can to continue the validation of prescribing traditional chemotherapy and narcotic pain relievers and all the other benefits of big pharma that they use in traditional medicine only, while yelling loudly against anything having to do with any type of integrative medicine being employed with it. And so, quite frankly, on our show today, who's the name of this big pharma darling, and he would be called Dr. David Gorski. Now, interestingly enough, Dr. Gorski is a professor of surgery and oncology at the Wayne State University School of Medicine in Detroit, Michigan, and he's also the managing editor of Science-Based Magazine. Dr. Gorski suggests in an article just a few months ago on Medscape that integrative medicine misleads, now this is a quote, integrative medicine misleads by building upon established health practices. Integrative medicine incorporates a host of other therapies of decidedly unclear scientific value. Because these unproven therapies are placed alongside established health intervention, critics argue patients are led to believe the entirety of what integrative medicine offers is valid. And then Dr. Gorski appears to be leading the battle call against anything that is not big pharma. And he spent a great deal of his time attempting to publicly discredit any type of physician, MD, who doesn't agree with him. And in this particular article that we were talking about, that he doesn't attempt to discredit acupuncture that I had read that was just recently published, but he certainly attempted to do so in previous writings, especially about battlefield puncture. Acupuncture. In the Forbes magazine article, he was quoted from a Science-Based Magazine as saying, and I quote, "Battlefield acupuncture is so ridiculously implausible that you may want to laugh out loud. When you learn that it is being taken seriously by the U.S. Air Force and that we are spending tax dollars to train military doctors in this method, you might want to cry instead. But when you learn that they are actually subjugating injured soldiers to this nonsense instead of offering real medicines, you should get really pissed off," unquote. Now, Dr. Koda, as I was reading more and more of his quotes and things that he was saying, it is, as I said, so obvious to me that in some way, shape, or form, he's part of Big Pharma. And it's been going on for years where they have been trying so hard not to bring things like acupuncture or chiropractics or, whatever to work alongside a traditional medicine because it works. And if it works and you don't have to have narcotics and you don't have to have all these other things that Big Pharma prescribes, then what is going to happen to Big Pharma? So I am so glad to hear, Dr. Koda, what you were talking about, that the U.S. military, the Air Force, in the field of battle, so much feels that it works just as well, if not better, than narcotics to relieve pain is a huge, huge testimony until exactly how important acupuncture is, even out in the regular lay world. Now, I'm going to be quiet for a minute because I've just been on my soapbox having a tantrum. And I would like you to give some of your thoughts about some of the things I just said.
Well, I think that makes a certain degree of sense of what he said, because it sounds logically implausible that putting some needles in the ear would have such a ridiculous benefit, because you can't dissect a body and find the connections. And so clearly it's more complex and more potentially microscopic than we fully understand yet. We clearly do know that if you stimulate some of these points, different areas of the brain actually become more or less active, and so that has been shown in some studies that have been done. But as far as on the battlefield, the other thing that's a little bit ridiculous, not knowing what he's talking of. I mean, the soldiers are not kept from any sort of treatment or narcotics at all. It's actually probably the most cutting edge trauma surgical abilities are offered to the military members within minutes to hours of their injuries, and so the survivability from horrific injuries is quite amazing. And the acupuncture is just a very nice tool that, as we've talked about before, and the battlefield example I mentioned is very practical and useful. I can go on with lots of stories, but one of the stories that some of my colleagues related to me back when we were in the early days of training folks out in the front lines was, you get some younger medical types that you teach this one specific technique to, and you go back later and they say, "Oh, this worked so great. Look at what we do." And guess what they were doing? They were putting tourniquets on each other and putting the needles in their ears and going, "Look, it doesn't hurt." And so,
no.
It's probably not a good idea to do something dangerous like that, but that's great that it works really well. And so, yeah. And, I can guarantee you that every last person that was ever trained in it would have thrown it away right away if it wasn't helpful, So, but instead they were doing crazy stuff like that, which young military types do,
Well, that says quite a bit, and I want to thank you for coming on our show today, Dr. Koda. I want to encourage everybody who is interested in acupuncture. Dr. Koda has given a number of short instructionals on different types of acupuncture to use for things such as nausea relief. Let's say you're pregnant and you have morning sickness, to be able to use for losing weight. What are some of the other things acupuncture can be used for, Dr. Koda?
Quite a lot of things. I mean, among the more common things that I use it for are lots of mental health conditions, gastrointestinal conditions, pain relief, actually getting off various addictive substances like smoking is very good for smoking cessation, nerve problems, nerve pains, actual nervous system disorders, which there is no cure and no good treatment for, like ALS or other things along those lines, or other nervous system tumors, things like that, where, I've had patients tell me that all they get from, the best specialists in the world is they monitor their progressive decline, and, the acupuncture actually helps them. So things like that. It's used for skin conditions, allergic conditions. I know that sounds crazy and outlandish. I can go on and on for, all the various conditions, even respiratory conditions I've treated successfully with acupuncture needles. It doesn't make a lot of sense to us in our Western brains, but can't argue with the results. It's helpful for a lot of folks. And I will also say that I never prevent any patient from having normal standard medical care. They can have all the standard medical care they want. They can choose that. They can choose acupuncture. They can choose both. As long as I don't feel it's going to be dangerous for them to choose one option or another. I don't give them the option of doing whatever combination they desire. So.
Well, I think everybody should know that we will be having Dr. Koda on our group page, our CBI Natural Health group page, where we will have him and other physicians to be able to do a question and answer series. For those of you that visit our webpage and read our blogs or listen to our radio shows, you can talk directly to the individuals that are in the know, ask your questions, have conversations, and even network with some of the other people that are in there. And so as you're looking and listening to this audio, look around. You will see a link there where you can go to this Facebook group page and find out the next time that we will have Dr. Koda on, specifically, and we'll be having one of those question and answer series. Plus the fact, if you will look elsewhere in the archives on the page, all of his other audios and blogs that he's done on other types of acupuncture. Well, thank you again, Dr. Koda, for joining us today, and we will be talking to you soon.
Okay, thank you, Linda. It's good to be here.
Goodbye, everybody.
Bye.